ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health to look into his crystal ball and tell us about some of the health trends he hopes to see during 2023. Dr. Alozie, let's start with COVID-19. This is one virus not going to go away.
No, it's not going away anywhere. And so I think we are in a better place in 2023 than we've been in a long time. COVID is going to continue. If anybody thought by now that COVID was going to be something that was going away, they were incorrect. However, some changes are going to occur. The public health emergency is probably going to come to an end in the next few months. We've already seen a dramatic cut in the amount of money that the government gives to either to hospitals, funding vaccines, funding testing. Expect to see more subvariants. We'll talk about that in a bit, but XBB is really on the horizon of what we're talking about right now. And you know, vaccines are going to become more and more controversial, fortunately and unfortunately.
Now let's talk about the potential spread of variants.
Yeah, so you can see this, that going all the way back to 2020 and 2021, whether it was Alpha, Delta, Omicron, I think the important thing right now, Mark, is that we sort of settled in. This XBB 1.5 and XBB 1, they're actually sort of cousins of Omicron. And so it seems as if the virus has stabilized in the Omicron, which is good news because most people have protection against it. And we have vaccines to help those that don't, specifically older people.
Now, we heard a lot about monkeypox in 2022, but now it doesn't seem to be as much as of a concern.
Yeah, I'm glad about that, right? And so we had that conversation. I think I remember saying really clearly, this was not going to be something that exploded across the globe. Some people wanted to vaccinate everybody going back to college. I think that was way out of proportion. And if you look at the next slide, you can see that from that peak of about 430 cases, we're all the way down to under 15, right? And so that is critical.
You're also saying we're going to see more technology in healthcare in 2023.
Yeah, and that's historically been my wheelhouse as a former chief medical informatics officer. We're already seeing with chatbots that have come online, writing people's papers, artificial intelligence is huge, right? That same technology will pivot into healthcare and make diagnosis and understanding notes a lot better. We're going to see more and more virtual visits. We'll talk about that shortly. And we're already seeing the emergence of the big boxes like Amazon, Walmart, and CVS in that space to take over healthcare. And I really believe that healthcare is going to change over this next generation.
Talk a little bit more about the digital health technologies we could see this year.
Yeah, so I mean, on my hand, I have my Google Watch, right? I wear a ring called an Oura Ring. It measures my sleep, my steps, my heart rate, how much I breathe, right? And all those things supposedly help me get healthier. We're going to see that technology start to even ramp up even faster because the technology that we use in healthcare right now is very analog. We need to pivot to a digital age that matches what we do when we go to the bank and online. And I really believe over the next 10 years, you'll see some of that this year. It'll change dramatically.
And virtual visits fell into favor because of the pandemic. So will that trend increase?
Absolutely. So people, the patients, some people don't like to be called consumers, but the people that direct their healthcare, even if it's not the patient, they're payers, right? So an Anthem, and an Aetna, whomever it may be, a Blue Cross, they're going to push a lot more things out of the four walls of a hospital, out of the four walls of a clinic and say, hey, you can have a simple visit online. And I think that's what's going to happen.
And there is going to be good news for diabetics, hopefully soon.
Yeah, so this is really interesting. I'll spend a little bit of time on this. Monjaro is for diabetes, but when taken in twice the dose, what it showed is that people can lose up to 22% of their weight over an 18-month period. That's essentially an average of 52 pounds. Now, what people may not know is that this is the cousin of Ozempic, and this was brought to fame by Elon Musk recently when he said he lost over 25 pounds by taking Ozempic shots. Exciting news for those that are struggling with losing weight. The sticker shock is that it's over $1,100 a month.
And I guess it's not covered by insurance just yet.
It is not in that form.
All right. So what are the treatment breakthroughs we can expect to see in 2023?
There's a lot of exciting things. I mean, the Stanford drug for cancer is exciting. The FDA has accelerated approval of Oxybrata, which is for sickle cell anemia. That's amazingly exciting to a group of children who have this disease that takes an immense toll on their life. But speaking of cancer, Keytruda is a drug that is brought up by Merck and a bunch of other companies that has actually been shown to reduce cancer morbidity and mortality rates by 44%. It's expected to be approved this year. All in all, 2023 shapes up to be an amazing year. Healthcare is evolving. we still got to figure out the basic things, right? Like eating better, exercising, but there are breakthroughs in therapeutics that are going to change the world around us.
And we've got 11 and a half months to talk about all of
Absolutely.
that stuff. ABC 7 medical contributor Dr. Ogechika Alozie, thank you, sir.
Thank you, sir.